A Dunedin oncologist has taken up a top role with the Cancer Society as its medical director. Dr. Chris Jackson joins us to discuss the job and the latest funding woes for cancer patients. Good evening. What attracted you to this new position?
Well, I think the Cancer Society is an extraordinarily important organisation in New Zealand. It provides an enormous amount of supportive care for patients affected by cancer, as well as being an authoritative and definitive source of cancer information. And is a very moderate and reasoned body, so I think it's a very important body in New Zealand. Also, it's the only umbrella cancer charity. There are a lot of tumour-specific cancer charities, but this is a pan-cancer body, so it takes a view across all the different cancer types. And so from forming public policy on cancer, it's a very important group.
How long have you worked as an oncologist in Dunedin?
Well, I got back from the UK in 2008. I did some training over there at the world's first cancer hospital, the Royal Marsden, and it's good to be back. It's gone very fast during that time.
And what are you aiming to achieve in this new role?
Well, the Cancer Society is it's a really interesting time. There's a new chief executive, and with the new chief executive there's a number of new board members as well, and it's going through a period of refresh, which means we're looking at the whole work program that the Cancer Society does, and it's a great opportunity to be part of that. So we're looking at the whole cancer gambit in terms of cancer control, in terms of supportive care, and how we advocate for patients, how we support them, and looking for ways we can advise government to better improve public policy on cancer.
Now, Pharmac has just declined funding for a new melanoma drug. Tell us a bit about that.
Yeah, this is a thorny one. Melanoma is more common in New Zealand than any other country. And over 3,000 New Zealanders are diagnosed every year, and 350 New Zealanders die from that, and there are currently no funded effective therapies. In Australia there are 4 funded melanoma drugs and none in New Zealand, so it's a real area of unmet need. The drug that everyone's talking about, pembrolizumab, there's talk, is it effective, is it cost effective? There's no doubt it's an effective drug, number one. Number two, it's very expensive, and the question is it good enough to justify funding ahead of other drugs? And I think that's what the debate really should be about, although there's a bit of noise around that.
How hard is it to get cancer drugs funded in this country?
Pharmac released a report recently which said that our access to cancer drugs is similar to that in other countries, but that's just not true. We're very far behind other countries in terms of availability. Pharmac spends less than other countries do, which is good. We're getting better value for money, but also we do have lesser access to cancer drugs. There's a very high bar to get across that line.
What changes would you like to see then over the next few years?
With Pharmac specifically, or with cancer policy in general?
Pharmac
in particular. Well, there's a couple of things they could do differently. I think the problem with the current debate is that it's operating in a bit of a vacuum. There's talk, is it effective, but there's no real ways of Pharmac telling us how effective they think it is, not like a drug scorecard they could give that. Number two, we could be more privy to the cost effectiveness information they give, and that would help us understand the debate better. So if someone goes, why fund this melanoma drug when this breast cancer drug's better? Currently we can't say that, we don't know that. So having a bit more transparency and openness around that I think would be really informative for the current debate.
And you're heavily involved in the bowel cancer project as well. Tell us a bit about that.
So the team I work with, Cancer Trials New Zealand, led out of the University of Auckland and collaborators here in Otago. We've just finished New Zealand's largest study of any cancer ever undertaken, 5,500 patients. And we've analysed the key aspects of patient care which influences patient outcome around the country, and have made a number of recommendations for how we can improve colorectal cancer care in New Zealand.
What are some of those recommendations?
There's a number of very important recommendations. I could talk about that all night. But in brief, one of the things we need to do is we need to focus on early diagnosis. Over a third of the patients diagnosed with colorectal cancer have it found out in the emergency department of the first time they're diagnosed, which is way too late. So a real focus on early diagnosis, and that feeds into the need for a national cancer screening program for colorectal cancer. Number two is improving a number of the key quality indicators that we have, so reporting our outcomes around colorectal cancer so we can see how we're going and we can work out whether or not our investments in care are actually paying off.
Dr. Chris Jackson, Cancer Society Medical Director, congratulations on the position.
Thank you.
Thank you for your time and Merry Christmas.
Thank you.